I'm Dr. Ken Altman, Vice Chair for Clinical Affairs in the Bobby R. Alford Department of Otolaryngology at Baylor College of Medicine. I'm here to talk with you about workflow. There are extensive demands placed on the average practicing physician, whether you're in an academic practice or in a private practice. We need to see lots of patients in order to have enough revenue to support our practices. Yet we're also responsible for a high level of care of our patients, and in doing so, not just documenting for our own continuity of care, insurance documentation, but also communicating with the primary doctors that are sending you the patients. Especially complex today is the fact that the patients are moving around the country. They may have their electronic record in one location, and they move to another part of the country where they need continuity of their electronic record. It's really important that we piece together all the different pieces of electronic information into one source so that they have a record of it and they could take it with them, and we communicate with our primary doctors in the process. One of the initiatives we've been working on in our department is continuity of information from the stroboscopy machines into the electronic record. With our traditional workflow, we do a stroboscopy exam on a patient, document in the electronic medical record on that same patient, and then when the visit's over, take these two pieces together and either stuff them in an envelope and ship it off to the primary doc, or electronically fax it to them without the pictures from the stroboscopy. It's really important to tie together this connectivity. We've worked on a number of initiatives over the years in order to be able to extract the records of the pictures from the stroboscopy and pull it into our electronic medical record. But now we've been working on a partnership where we've been able to work out the electronic communication seamlessly, where this information is actually pushed from the strobe machine into our electronic record. It makes it quite a seamless transition where the progress note and the letter can be pieced together with the appropriate photos before it gets sent off to the physicians. One of the other important initiatives is the use of the direct address. Every physician in this country actually has a direct address, email-looking identifier that's assigned to them by their use of the electronic medical record. With this information, we can actually push it into their inboxes even if they're at another institution or if they're using a different electronic medical record. This seamless continuity between the different electronic information that we could piece together and actually push into an outside physician's information box is going to be critical to the continuous care of the patient. So much of what we do is time intensive, and ever since the conversion of the electronic health record, I spent so much of my time looking at that screen instead of looking at the patient. Quite frankly, the seamless electronic communication that happens automatically now allows me to take more personal care of my patients. I believe that we're entering a new generation of the electronic medical record and how we use it in healthcare. We're now at the point where technology is no longer a burden in how we manage our workday. We've now improved our workflow so we can take more personal care of the patient.